Hello, my name is Angela Rainey, and I'm a clinical nurse specialist at Emory University Hospital Midtown in Atlanta, Georgia. Along with my CNS colleague, Becky McKee-Waddle, we will present to you our project, Being CAUTI-ous, a hospital's journey to reduce indwelling urinary catheter utilization to prevent CAUTIs. Catheter-associated urinary tract infections, or CAUTI, are the fourth most common hospital-acquired infection and accounts for nearly 93,000 UTIs annually in the acute care setting. Our hospital has been on a journey to ensure quality and safety for our patients and employees every day. There were several initiatives that contributed to reduction of CAUTI and indwelling urinary catheter utilization over the past several years. Prior to the initiatives, the role of the nurse was limited to general communication with the provider. The aim of the project was to decrease the incidence of CAUTI by maintaining a standard infection ratio, or SIR, of less than 1. This would be done by reducing the use of indwelling urinary catheters per a standard utilization ratio by August 2021. Our baseline conditions were as follows. Prior to this initiative, CAUTI-specific unit-based champion responsibilities were not identified or developed to focus on data analysis, best practices, and staff education. Our infection prevention team engagement was limited, and not all infections were reviewed in depth to identify causes of infections. The standard utilization ratio metric, or SIR, was not implemented at the time to track urinary catheter usage on the units. And alternative external urinary devices for females were not available for patient care. I'm going to hand it over to Becky, and she's going to talk about our actions and tests of change, as well as the results of our project.
Hi, everyone. Our hospital developed a CAUTI apparent cause analysis tool, or ACA, to identify contributing factors or gaps in care that help us to then develop specific action plans for the individualized nursing unit. As Angela said, we began using the SIR and SUR as our metrics. We developed a CAUTI leader rounding that we did monthly and an annual point prevalence round. We also developed a CAUTI Champions Committee that included one rep from each nursing unit. Each meeting, we would discuss the recent CAUTI ACA findings, any barriers that the champions were meeting on a unit level in trying to reach their CAUTI targets. The champions were responsible for completing monthly audits, including direct observation of the patient's catheter and verification of a physician order for that catheter that included an indication for use. The champion would check the catheter care, that it was completed and documented in the chart 2 times a day. They were encouraged to talk with providers on their unit if any ACA findings occurred, and to educate their fellow colleagues regarding any evidence-based practice in catheter management, which included the hospital's nurse-driven Foley catheter removal protocol. At the bottom of your slide on the left, you will see 2 of our renal champions that developed a magnetic Be CAUTI-ous flag. This would be placed on the doorway to a patient who had a Foley catheter as a visual reminder for the staff to assess if there was truly an indication for the patient to have a catheter and if it could possibly be discontinued that day. The hospital implemented a new male and female external urinary catheter as an alternative to a Foley insertion. The graph you're seeing is our SIR on a monthly as well as a 3-month rolling data. In 2019, our hospital's 3-month rolling data of the SIR was greater than 1 and not consistent throughout the year. During the pandemic in 2020, we saw an increase in our overall SIR, especially during the peak months of COVID-19 that you'll see on the graph in May of 2020. Despite this increase, the hospital maintained a rolling 3-month SIR of less than 1, thus meeting our project aim. Our results included the number of CAUTI-ous reduced by 20% within the female population and 8% within the male population. The Be CAUTI-ous Flag initiative has now extended to other nursing units as a visual reminder for healthcare staff. There has been an increase in the appropriate use of external catheter devices, both male and female, as an alternative to Foley catheter insertion. We would like to thank you for spending your time to hear our hospital's journey to decrease hospital-acquired Foley catheter urinary tract infections.